Morning, everyone. How's everyone doing? Is someone recording this?
You want it recorded?
I think I could just record myself so we can put it in YouTube for the other people that were not here.
Okay, I started recording, ma'am.
Okay, cool. All right. So, thank you everyone for coming. Did we already get attendance? This is our commander's call for April 2020, the ever first virtual UTA. And really appreciate all of you for coming. And I really thank you for all the hard work that you've been doing. Everyone's contribution is vital to the Air Force, to the wing, and every one of you is appreciated. And I am truly grateful, and I'm truly humbled and honored to be your commander. And in fact, even during these difficult times, people are still re-enlisting. And today, later after this, I will be re-enlisting Tech Sergeant Gonzalez. Woo! So,
Yes.
and yesterday I have enlisted, I have sworn in. I have sworn in Captain Stevens as one of our flight surgeons. So let's go ahead with our commander's call, and I have the agenda. Colonel Bo, if you care to do the slide, please.
Oh, that was cool.
It's cool. So Colonel Bo, not too fast. So
Sorry.
the the agenda for today, and if you have already attended the Facebook Live, so I will not repeat what the wing commander said, Colonel Cosgrove, because there were a lot of information there during his Facebook Live. So I hope you have attended it. If not, you can still attend for from YouTube. So agenda for today is to discuss the TAGS wings, commanders, the wing commanders, and my own commander's intent. COVID update, task force update, and what to do when you are activated, and expectations, and our virtual UTA roles of engagement. And we will touch a little bit because I don't think I have put down in Air Force Connect Air Force standards on haircut and physical fitness testing. But I hope you have read ahead of time our newsletter and the Air Force testing, physical fitness testing is there as well. So the TAG's intent is to protect the airman, and this is also the wing commander's intent, and you heard it in Facebook if you attended today, to protect our airman, protect the mission, and to protect our community. The airman is you. So you have to protect yourself before we can do our mission and before we can help out the community. So I know some of you are out there and waiting to be visited and waiting to be called at. I could not possibly reach each and every one of you because I am myself quarantined right now. So please, supervisor, reach out to your airmen who are out there, and even if they're at home, the physical isolation has an impact on every one of us, and it's different for each one. So reach out, and as Chief Rivera said in the Facebook Live, call. You don't even have to say, can I call you, but just call. It's very important that we reach out to our fellow wingman. And my other intent is to be out for you out there, to be safe, to be vigilant, responsible, and proactive to support the mission. As a medical group, we are here to support the mission, but we have to be safe first. We have to be vigilant and be responsible, and so really adhere to HPCon Charlie / Delta, because it is very important that we stay healthy, and we are tasked so much these days, and we have to stay healthy to help out our fellow wingmen and New Jersey and the whole nation as a whole. We're not only actually helping the state of New Jersey, but we are expanding as well to the state of New York. So be safe out there. And as General Kennedy have said, limit your circle. It's very important. That's why I really insist that no one goes into the medical group, and don't be offended that I say that you have to ask permission from me. Don't be offended by that, because it is for your own safety. It is for our all whole safety, because if that medical group building will be contaminated, we have to disinfect the whole thing, and it's a lot of effort, a lot of money, and a lot of lives that we can save if we stay where we are, if we stay to telecommute and to just do our little contribution. It will really help a lot. So the next so can we move on to the next slide? We have also the task force update and the COVID update, and I did that kind of ball. So next, click and
Sorry.
click. It's okay, no problem. So for our COVID update, actually I have it right now. It's really, the update right now is really a lot. We have actually, so sad, statewide 231,086, the whole nation statewide. And in the state of New York, you have seen there 14,832 deaths. In New Jersey, we have 3,518 deaths, and that was just yesterday. And in New Jersey, we have 75,317 cases altogether. So we have to be very vigilant. And as I mentioned before, staying safe is the best way to do our job. Just do speak on Charlie/Delta and reach out to everyone. Our own 108th wing, we have 3 positive cases and actually 5 in quarantine now. We have 59 members that were returned to duty. And our own medical COVID-19 update for the medical group, we have 1 positive right now and 1 in quarantine, which is me. Next slide. So the task force update. This email was sent out to you by Master Sergeant Muger. So things to bring with you. Keep an eye on this. If you have pen and pencil right now, write this down. You have to have your BLS or CPR certificates, your electronics, phone, whatever you need. Shampoo, toothbrush, and he really put this down in the details so that you can really be prepared when you go out there in the field. Don't forget your ID card. Don't forget your ID card. And refillable water, even refillable water bottle he put there, and that's really, really great. And so the shirt really helped out too much with that. So thanks, shirt, for keeping our folks proactive and prepared for the task force taskings. Next slide. So this is the task force for COVID-19 in action. I asked them to send me pictures, and look at Sergeant Day. He seems very, very happy. They're taking temperature on the right hand. It's just not so clear, not a little blurred, but that's him. Captain Holly, who's leading the group, is there as well. Captain Kocharski. Everyone there is helping out. Lieutenant Bass is our latest addition to go out there, and she's working in Minlo Veterans Home. And please say a little prayer for her. She has some challenges out there, not little but a lot. And next slide. So their accomplishments, as I have prepared the slides and maybe more, if you can see there. They have served 89 people. I'm guessing as of today more, and discharged 22, and there are 48 beds full right now. So, do you recognize the one in the picture, Colonel Stevenson? Anyway, okay. Um, do you have any questions so far? Next slide. So our virtual UTA rules of engagement. Click. Everyone is expected to attend the mandatory sessions. Next. Everyone will be audited, so keep a tab of the hours spent with whatever you're doing. Click. This is our first UTA, so be patient with yourself and be patient with others. We are learning from each other for this UTA, so make your own action report. Click. Next. Next. Please make sure that you write down what went well, what didn't go well, and what we can improve for the next UTA. As Colonel Cosgrove said, next UTA in May will be a virtual UTA again. Next. I would like you to keep a gratitude journal for this UTA. So I give you a minute to write down 3 things that you are grateful for. Okay, have you written those?
Yes.
Okay, cool. Alright, keep it to yourself and we'll share it sometime, someday, or tomorrow. Next. We are still required to do our readiness alert, and per General Kennedy, there's no relief on this. We have to be ready. That's why we're still doing this UTA even if we are far away from each other or physically distant. Next. He mentioned there is no or zero fail mission, so we really need to be prepared. I know that it was mentioned that the PHA for flyers has been extended for 90 days if they are late, or if they are due, not late, but if they are due. But we should be ourselves be proactive and do our PHA, PHAQ. I know most of us in the medical group is current because of our one-time PHA. And I would ask you to those who are full-timers, and today if you can add some PHAQs, reviews. Yeah. Next slide. As mentioned in the Facebook, there was a fitness challenge and a mustache challenge. So the Air Force standards on haircut has been a little bit lax, but we cannot be lax on our readiness posture. Did you see that mustache? How's that? You can beat that, right? That's my brother. He's 74 years old. That was taken last year. So I just put him there. I just put him there. So anyway, we cannot be relaxed with our readiness posture. So before the questions, would really like to emphasize, Lieutenant Dahl was asking about us to be an expert on COVID and to give out to the wing some information on COVID. As I mentioned earlier in my Air Force Connect and in my commander's brief to you, you can go to cdc.gov and find out about COVID-19. And I'm sure everyone is doing that. If not everyone is doing that, you should do that so that you can be also an expert. If we go out there and I think that's the best way to do to direct everyone to the CDC guideline, because we go by the CDC guideline and our own local policy. Other than that, there's really no vaccine right now for COVID-19, and the best way for us to avoid it is to avoid exposure. And we have been saying to ourselves, clean our hands often, and if we cannot wash our hands with soap and water, we have to do a sanitizer with 60% alcohol, and avoid touching our face with unclean hand. And social distancing is really working. So I would say they said physical distancing rather than social distancing, because we as human beings, we are social. We want to reach out to people, so that's why we reach out to our airman, we reach out to anyone. So we have to still be socially engaged, so we will not be isolated. We don't feel isolated. We have Jill Barrett, who offered us mental health counseling virtually. And how we can avoid more and be safe is to stay at home until you work. And if you are sick in your civilian job, don't go out, stay home. And again, cover your mouth. I know we're medical, we know this, but sometimes we become complacent. And at this time, complacency is not a good thing at this time. So cover your mouth when you cough or you sneeze, and throw away the tissue and wash your hands right away. And the wearing of a face mask is actually a DOD directed. It's DOD directed, so it's an order. So you have to have a face mask when you go out. So probably the new norm will be clean and disinfect, and that would be the new norm. And
Guess what? All that shit comes flying out.
Guys, put your phone on mute.
Somebody has a hot mic.
it's okay. I know already. I don't have to review with you the symptoms for COVID, because I know you know already. But the big thing is, just watch yourself. And I would still ask every one of you to really have a thermometer at home. Have a thermometer. It's like right now, it's like a Band-Aid. Thermometer is like, not even a Band-Aid. You have to have it at home at this time. So don't be complacent. Reach out to your wingman, to your supervisor. Reach out to us if you need any help. Chief Hill, Senior Master Sergeant Miller, Master Sergeant Mulger, and Lieutenant Colonel Bo are there to help you in the nursing department. Major Barros is there. Captain Rogers is there as our replacement for Lieutenant Hansen. And she's helping with PHA as well. As one Staff Sergeant Smith is there to help us, and she's guiding us with reporting for the JOC. JOC is Joint Operation Command, and new cases and whatnot. So reach out to anyone out there who are having problems right now. This is a very difficult time for every one of us. So that's all I have. Any questions? Next slide. Don't you just like that? Okay, you can open now your mic for questions.
Let's see. I'm hoping that we might have got to the 40-minute mark. Hold on, let me see. I think we dropped.
Really?
We had a pop-up saying that it was upgraded and we have unlimited time, but I don't know if anybody else got that as well.
Oh yeah, we're still in. Okay, good.
Okay, so who has questions? The floor is open.
So you can see each other. There you go.
You can see me now?
I have just a couple things. While we have the sections, let us do new members in your sections. Guys, anybody want to mention that?
Nursing services has Airman Bouquet, if you want to introduce yourself to the group.
Public health has been back.
Admin
Oh.
Price.
All right, go ahead.
Okay.
Okay, Vasquez.
Hey everyone, I'm Herman Vasquez. Again, don't really know what to say.
No, you have to have something to say. Well, where are you coming from? And what's your background?
What is your civilian job?
I'm from North Jersey. I actually live in Belleville, New Jersey. And my civilian job, I'm a clinical trials coordinator at St. Joseph's in Patterson, New Jersey.
Hey, what's that stuff up in your corner, up in that behind you, up in that shelf?
Wine bottles.
Okay.
Yes, sir.
Just don't do that until after work today.
Okay.
Okay, and then we have Captain